Good morning to all of you. Welcome to the program agenda. I'm Cito Beltran, your host. Today is March 8, 2021, and the reason I know that is because it's my sister Malu's birthday. Happy birthday in New Zealand, where apparently they are on level 2. Level 2 regarding safeguards for COVID-19. So yan po, no? Hindi lang sa Pilipinas, kahit sa New Zealand na napakahigpit, where they're really tough, they still have quarantine measures, or at least strict measures. Some shops are open, but they're still required to observe social distancing, health protocols, and I hope that you are doing likewise. It's a Monday. Welcome to the program, and you are watching us via Signal TV channels 8 or 250 for high definition, and if not, chances are you are watching us via facebook.com/onenewsph, and you can also watch us via YouTube. Just enter One News PH and search out agenda. Okay, now for today, many of you might be wondering who are our guests. Well, we have been trying to get Congresswoman Representative Angelina Helen Tan, the chairperson of the House Committee on Health, for various reasons. First of all, para magkaalaman, because Congresswoman Helen Tan was the subject of media coverage and focus last week or a week ago, because she got vaccinated at the Veterans Memorial Medical Center, primarily because her son is a surgeon. Marami pong bumatikos o may nag-comment na hindi naman uminit, hindi nagliyab. The incident did not catch on, it seems, but there were comments as to why a congresswoman got ahead of the line or jumped the line. But we are going to give the chance to Congresswoman Tan to explain and clarify matters. Medyo alam ko na kung ano yung talagang end of the argument point dyan. Pero we will let Congresswoman Helen Tan talk about that. And we will also ask her about the Philippine version of the CDC, Center for Disease Control ng Amerika. Meron na raw dito sa Pilipinas gagawin na Center for Disease Prevention and Control, hindi lang control, which is, a lot of people are kind of wondering about that. Is it possible? And how are we going to go about it? We will also speak with one of our favorite guests here on Agenda, none other than Secretary Bernadette Romulo-Puyat, or Secretary Berna Romulo-Puyat, regarding the state of affairs, because may mga nag-reach out po. There's a sector that has reached out to me, primarily the mom and pops, the Airbnbs, the backyard operators for tourism, who are appealing that they be looked after. Kumbaga, pansinin naman po sila, because their operations or their business is actual livelihood, not investment, not commercial interest, but actual livelihood, especially in the time of pandemic na maraming nawala ng trabaho. So we will speak with Secretary Berna Romulo-Puyat on that matter. And of course, we will also talk to her regarding other tourism-related issues here on Agenda. In the meantime, let me catch my breath. Let's go to the front page of the Philippine Star. And if you don't have access to the physical newspaper, you can read the Philippine Star on Safari, on your laptop or your gadgets, and you will be able to read the Philippine Star. Okay, sorry about that, Team Agenda, studio. Let's go to the front page now. Okay, Octa Research cautions that COVID-19 cases in the National Capital Region is surging at a fast rate. How fast? It's the same as the rate seen last July of 2020. It has also been 3 straight days in which the country has tallied over 3,000 new daily cases. If you would recall our interview with Professor Guido David of the Octa Research Group, I asked him a very direct question: are we on the third wave? And that was last week. And he said, Cito, we are in the beginnings of a third wave. And today in the Philippine Star, I wrote an article regarding this because it seems that a lot of people have started to drop their guard, loosen up, and start moving around, traveling. It's okay to move around. If the government says you can travel, travel, but it's not okay not to wear a mask, not okay not to social distance, not okay to observe health protocols. Ang dami po na nag-birthday party, nag-get together. Pag nakadalawa, tatlong tagay na, nakakalimutan na may nakakamatay na COVID. Pinapaalala ko lang po sa inyo. Okay. And going back to the front page of the Philippine Star, the government is tightening the enforcement of health protocols excuse me, to curb this surge of new COVID-19 cases. Cabinet Secretary Carlo Nograles said police and local government, as well as the Metropolitan Manila Development Authority or MMDA, will all have to step up effort. So wag po kayong ma-alarma, do not be alarmed if those good old checkpoints start popping up all over Metro Manila again, if people in the barangay start patrolling the streets again and start accosting you if you're not wearing your mask and your face shield. Sorry, but I think we only have maybe 1-2 million. I don't think we even have 2 million vaccines in the Philippines. Okay, we have maybe 1 million plus, but not 2 million. And there's about 100 to 110 million of us, and COVID-19 is still in the country. Okay, so and speaking of vaccines, another 38,000 doses of AstraZeneca vaccines against COVID-19 have arrived in the Philippine shores. These vaccines come from the COVAX facility, which is led by the World Health Organization. Bravo! Sana yung 38,000 maging 38 million overnight. Kung pwede nga lang, no, parang gremlin, buhusan mo ng tubig, dumadami. In any case, let's go forward to our interviews for the day. Let's check if Congresswoman Angelina Helen Tan is on board already. There she goes, Congresswoman Angelina Helen Tan, chairperson of the House Committee on Health. Congresswoman, alam ko na rin naman yung dahilan, pero mabuti na yung I give you the opportunity to explain yourself kasi mukhang nabatikos ka last week. Some people had the impression that you jumped the line. And of course, kasi congresswoman attitude came into the picture. What exactly happened there? How did you get vaccinated at the Veterans Memorial Medical Center?
Good morning first, sir. Sa inyo po mga televiewers, good morning po. Thank you for the opportunity although sana tapos na the issue. What happened, sir? Kasi as you mentioned earlier, my son is a surgeon in BMMC and he mentioned to me they were asked to register family members, 3 family members, and he asked me Monday night, naka-register kayo ni dad and one of my son sa veterans if you want to avail. And then ako nag-isip pa, And then, morning ng Tuesday, naisip ko, since uuwi na ako ng probinsya, I texted him. Sabi ko, is it okay to avail na the dependents?
Mm.
Kasi syempre, iniisip ko din yon. But more than anything else, ang intention ko talaga, sir, because of that negative connotation on Sinovac, and that's the only vaccine that we have last week, no? Sabi ko baka it would help if I get vaccinated, not as a congresswoman, uh, but as a doctor also, no?
Mm.
Na mag-avail ako. And then, second siguro, as a congresswoman, hindi isipin ng mga tao na may special treatment sa mga legislators. They're getting the most popular brand, no? Napaka-genuine po nung aking intention. And nagulat ako kasi naging issue sa iba, no? I don't think, parang meron lang talagang gumawa po ng issue doon sa pagpapabakuna ko. But when I asked naman my son, very clear, and he even sent to me a memo na sa mga empleyado na iparehistro yung pamilya. So, yun actually, sir.
Okay, well, I actually expected that answer, Congresswoman, kasi nga, I think a lot of people forgot the fact that you are a physician as well. May nagtatanong lang, under this setup, are you categorized as a frontline health worker? Kasi nagiging parang ano ba parang nasagot mo na doktor ka pero hihirit pa yung iba. Doktor ka nga pero hindi ka naman frontline worker. Ano ba ang sagot mo doon?
Medyo confusing yun, sir, to others, no? Kasi,
Hmm.
syempre, ang kino-consider nila na frontline health workers are those who are actively working in the health facilities and in the community. And we know that I'm a congresswoman, but I'm a
Mhm.
doctor first before I became a congresswoman, which is something na hindi maaalis sa akin. In one of the interviews I mentioned, actually in the district or in Quezon, hindi po ako nakikita ng mga tao as a congresswoman. They call me as doktora, no? So ang tawag po nila sa akin doktora, and whenever I'm in the district talaga, I function more as a as a doctor. Sorry to
Mm.
say that, no? But
Yeah.
you know naman the clamor of the people, 'di ba, sir? Kahit congresswoman ka, pag pumunta ka sa barangay, dadating at dadating sila at nandyan sila lahat nakapila because they're expecting me to check on their health, no? So, parang ako siguro, sir, nakalimutan ko din na congresswoman ako. But I'm more of a doctor. So, ang sa akin, ang reason ko, kaya ako din inavail yon because I'm also a doctor, no? So,
Mm.
kino-consider ko, sir, ang sarili ko as a frontliners kasi every week yan yung aking, hindi nawala po sa aking sarili yung
Mm.
pagiging doctor. Although I'm not working actively or in a private practice in the hospital, I also go to the hospital because before I became a congresswoman,
Yeah.
I work in the hospital actively, no?
Mm.
So, siguro medyo na-confuse yung iba dahil nga then congresswoman ako and nakita nila siguro sa congress lang ang ginagawa ko, hindi ako nagpa-practice as a doctor. But I do practice free, no?
Mhm.
Public service, sir. So, yun
Okay.
medyo nagkaroon ng confusion.
Congresswoman, total, we are clarifying confusions already. Can you clarify for me, no, para sa akin lang, kasi may nagsabi sa akin noon na may hospital ka or may-ari ka ng hospital. Is this correct?
I used to be the medical director of the hospital, which I initiated. It's a corporation, sir. So, hindi
Okay,
naman
okay.
ako talaga yung majority na may-ari po nung
Mhm, mhm,
hospital. I'm one of the shareholders of this hospital, the
mhm,
family, no. But
mhm,
I was the one who initiated this hospital. Yes po. So,
mhm. So
relative.
in that regard, you can also get vaccinated because you are a stockholder of the doktor ka na, stockholder ka pa, tapos head ka pa ng Committee on Health. Ito meron lang request dito, can we clarify, was the vaccine made available because she's a doctor or because she's a dependent of her son. Actually, yun din ang liliwanagin ko sana,
Yeah.
Congresswoman, no? Kasi for purposes of transparency, I've heard of so many companies, no, and I myself, may lumapit na sa akin na isang ano sa church, no, sabi, Sito, qualified ka kasi nagpi-preach ka na, etc. Baka doon sa church nyo may vaccination program, because I've heard of other churches, companies na they're not only going to extend to their employees but also to the immediate family of the employees. Now, mukhang I think God works in mysterious ways, eh. And ginamit ka siguro para ma-address na itong mga problema na ito. Because, okay, you got it because you are the dependent of a physician.
Yes, sir.
Okay, that is based on what concept? Kasi sa private company, sinasabi nila, private company, they can do what they want. With
Yeah.
the government hospital, ano yung basis ng extending this to dependents?
That I do not know, sir, no.
Mhm.
Kasi when I was informed by my son, hindi nagulat din ako na meron silang privilege, no,
Mhm.
nung sinabi niya sa akin. And I even asked him the memo, no. So ako naman,
Mhm.
I thought that was clear in the government, no, sa ating mga namumuno sa gobyerno,
Mhm.
na merong ganyang polisiya po ang mga hospital and even other government hospital. Is just siguro, sir, na sensationalization sa akin because I'm a
Mhm.
congresswoman, no.
Yeah.
But prior to me, sir, there were dependents of health workers who were vaccinated. Ako naman, I don't wanna question that
Yeah.
policy. I guess that's one way of appreciating the sacrifices that our frontliners had been experiencing for
Mhm.
the past year, no. So parang para sa akin, sir, first linawin ko ha. Una,
Mhm.
I'll be very honest ha. Magiging tapat po ako sa inyo. When I went to veterans, it's because I'm a mother of my son who's a
Mhm.
doctor.
Okay.
Second on my consideration is, nung nag-isip ako before going there is, I'm also qualified because I'm a doctor and I work in
Mhm.
the ground.
Correct.
Okay? So, and then third is, I want to set an example
Mhm.
na no BIT on this one. Hindi ako nag-jump on sa line, sir.
Mhm.
Naka-register po ako sa veterans as a mother of my son and as a doctor siguro.
Mhm.
Kaya nag-yes sila because alam nila na I'm also a doctor
Ah.
when they said yes. So, um, hindi lang po sa veterans, I think, nangyayari yon. I ask other friends, no, who's
Mhm.
in other government hospital, if they were asked to register a family member, and they said yes. So some
Mhm.
governments, and it was approved by the National Vaccination Committee.
Yeah, but I think the spirit or the intention is, ano ang saysay, bakunahan ko yung doktor, pag umuwi naman siya, hindi bakunado yung pamilya niya o yung magulang niya, mamamatay din yung mga magulang niya, because the highest exposure are the frontliners, and we need to, and I'm not justifying for you or excusing you, no. I heard this discussion kasi recently regarding teachers and students and parents, and someone pointed out to me, Sito, what is the point of vaccinating one set of family members but not vaccinating the others? Mababakunahan mo nga yung workers, pag uwi naman sa bahay, yung mga lola, nanay, tatay, walang bakuna, di patay din sila. So
Yes,
it's a zero-sum game.
sir, tama po kayo. That's my last point, no?
Sorry.
Yes po. So, ah, napakalinaw naman ng paliwanag po ninyo, no, kung vaccinated ang isang, like the healthcare workers and other family members ay hindi naman. So siguro lang, sir, in a community, hindi ba tumatarget tayo, or in the Philippines they said we need to vaccinated at least 80% or
Mm,
70% of the population. Pareho lang yon. In a household, we wanted everyone get vaccinated, 'di ba,
mm,
sa isang tahanan. So, where do we start? Siyempre, sa lahat ng bagay, nagsisimula tayo sa tahanan bago pa tayo makalabas sa barangay or
Mm.
within the city, hindi po ba? So, I think that's where they're coming from, no? So,
Mhm.
kung etong mga lahat ng, if you have like, uh, 50,000 healthcare workers, and we extend it to the family members, we like parang times 3 kaagad yon, and yung
Mhm.
coverage natin ng protection mas lumalawak.
Okay, now next question ko, Congresswoman, may naging side effects ba? Kasi we are all promoting vaccination. Ako nga lang, medyo tanggal ako sa listahan dahil senior citizen daw eh. Pero sabi ko, hindi naman ako mukhang senior ah. At in
Yes,
any
yes.
case, in any
You're in the
case,
next group na, sir.
Oo, sabi, the question is, what may side effects ba sa'yo? Because we want to promote vaccination.
As for me, honestly speaking, sir, wala pa ako naramdaman na any side effect. No, even
Mm,
immediately after the inoculation, wala
mhm,
akong pain, walang heaviness on my right shoulder. And
mhm,
then yung expectation na baka lalagnatin,
mhm,
sasakit ang ulo, wala po akong naramdaman. So,
mhm,
for the past 7 days, wala po. As in, walang
mhm.
symptoms ako naramdaman.
Okay, now, itong next topic naman, itong creation of the Philippine Center for Disease Control, no? Kasi may mga nagsabi dapat disease prevention and control. Sabi ko, yung disease prevention sa DOH yun eh, yung disease control dito sa bago. What are your
Yes.
inputs on this subject?
So sir, after eto nga with this experience ng pandemic, nakita natin yung how weak the health system, no.
Mhm,
We do have the existing mga divisions within DOH like ang naging problem natin surveillance, 'di ba sir, in the
mhm,
Epidemiology Bureau, the data reporting or data collection. So ang daming naging problema and until now I think we do have a problem. So we wanted to create one center that will focus more on the prevention, no, disease control and prevention, whether it's a communicable or a non-communicable diseases. So we're not only targeting yung mga infectious diseases, but I guess the goal here is that we'll have a good system on data collection. So basically, magkaroon na tayo ng profiling of the health of the Filipinos.
mhm.
So when a pandemic comes or epidemic or an outbreak, ready tayo lahat. So we will strengthen. So isasubsume natin, sir, yung existing division ng DOH, the Epidemiology Bureau,
Mhm,
RITM, sir. Alam naman
mhm,
natin yung RITM, nag-iisang reference laboratory natin.
mhm,
And then, the International Health Surveillance of the Bureau of Quarantine
mhm.
and Disease Prevention and Control Bureau of the DOH and the AIDS Laboratory po, yung STD AIDS Laboratory natin. So,
Okay,
ito
what
yung ilalagay natin sa CDC.
what about the Philippine Genome Center? Kasi I don't know if you cannot put them together, no? But I was just wondering bakit hindi sila kasali dyan sa CDC.
Sir, hindi namin to kasama kasi yung genome is under the UP system. Ang
Mm.
CDC po kasi is restructuring within the Department of Health and
Mhm.
creating a center independent, no, magiging technical advisory body siya ng Department of Health.
But
We
can
are creating at the same time virology center.
aha.
Sir, so that's another center, sir, which we think baka doon fit po yung genome. So we're exploring. Tomorrow we'll have a hearing on that. So
Yeah,
kailangan
because
magkaroon ng delineation, sir.
oh, kasi ang worry ko lang, Congresswoman, and I'm sure you're aware of this already, that under the UP system is already poorly funded. Tapos marami pang social services ang UP system because of PGH, the Genome Center. And it is not a surprise na maubusan ng supplies yung Genome Center. So either you make them an extended or a ano ba yung tawag nun, parang extension office, allied
Mm.
service or whatever, no, para lang wag nga. Pero is everything on the move as far as putting up the Center for Disease Control?
Yes, sir. Um, Last week, sir, nagkaroon na po kami ng hearing sa Committee on Health and we approved the substitute bill, no? And
Mhm.
we asked the DOH po to discuss it within the department before po kami nag-hearing kasi I'm sure merong mga reservation others, no, yung
Mm.
other high-ranking officials within the Department of Health. So I asked them to conduct a stakeholders forum and present it to the Committee on Health. And luckily naman, nakakame up sila ng substitute bill and we discussed it together with the members of the Committee on Health and we approved it, no. So medyo magandang naging kinalabasan, sir, kasi nagkaroon na nilist na nila ano yung mga functions of this division and ano lang ang pwedeng i-let go nila and explain nila bakit. Like for example, sir, in my proposal, I was proposing the Health Emergency Management Bureau or HEMB of the DOH to be included in the CDC. And maganda po yung justification nila na hindi siya isama to subsume under the CDC and sinabi nila it will become as the operation center. So to operationalize all the researches, the policies, the standards,
Mm.
nandito sa DOH po yung HEMB. So I think it's just a matter of time, work on progress, sir,
Okay.
in the Congress.
Okay, personal agenda. Obviously, ano. Personal agenda, Congresswoman. I have been asking around, but I can't seem to get a straight answer from anybody. Since COVID-19 hit the Philippines, everyone agrees that our biggest concern will always be available hospitals and facilities to address this. Now, ang sinabi ko, imbis na tayo build, siguro nag-focus tayo dapat sa build hospitals. And I have been asking, meron bang natayong kahit isang bagong malaking public hospital sa Pilipinas? Because I noticed parang kinalat sa mga barangay yung primary care, health center, and then meron lang secondary hospital, kokonti yung tertiary reference hospitals. And sabi ko, yung heart center, pataas na ng pataas kasi walang loteng paglagyan, etc. And kawawa yung mga nasa probinsya, sa regional areas na we are not investing. Given the reality of this pandemic, you would think that there would be more hospitals that were put up in the last year. Could you share your knowledge on this matter with us as a doctor and as a congresswoman?
Yes, sir. As the chair of the Committee on Health last Congress, we passed actually around mga 22 now enacted but unfunded. That is establishment and upgrading of hospitals, no?
Mhm.
So yan po ay sa iba't ibang parte ng ating bansa. Ang nakakalungkot nga, sir, siguro tama po kayo doon on prioritization pagdating po doon sa funding. Napakalaking problema po natin. And tama din po yung observation nyo on build na sana nabigyan ng pansin doon sa build yung hospitals, hindi lang bridges, hindi lang roads, and other buildings, no? So nagkulang tayo, sir, doon, no?
Mhm.
Honestly speaking. Okay sana po din naman yung primary healthcare, no, to strengthen kasi ito yung pinaka-accessible sa mga tao and
Mhm.
na-strengthen natin yung service delivery network which is the referral system. Unfortunately, sir, even if we have like mga district hospitals, alam naman natin na napakalaki po ng kakulangan ng mga pasilidad, hindi lang sa equipments, but even in human health workforce, no? So, hindi lang siya construction sir but
Mhm.
even the health human workforce and the system itself. Kasi kung meron kang magandang sistema, kahit na may kulang at maayos ang referral natin papunta sa isang facilities, I think pagdating nitong pandemic na ito, medyo may kakaiba sana tayong positibo na nangyari sa atin, no? So, ang honestly speaking, sir, yan
Mm.
yung kinaka-frustrate ko as a health advocate, no? Whenever I see funds na sobrang um, nagbo-bloat in other agencies, and
Mhm.
nakikita ko doon sa Department of Health, sir, yung HFEP, which is infrastructure po yun and equipments, ay napakaliit ng budget. And there was a time, I think last year in 2019, tinanggalan po nila yan ng construction. So tama po yung sinabi nyo, wala pong bagong hospital like yung PGH or heart center kung nakapaglagay ba tayo ng isang
New
facility
hospital.
outside Manila like
Yeah,
regional hospital na
yeah.
meron pong heart center. SPMC, sir, I think they have in Southern
Southern
Philippines.
Philippines in Davao.
Yes po, in Davao.
Mhm.
And I think in Vicente Soto, sir.
Mhm.
Um,
Pero mas matanda pa sa akin yung Vicente Soto Hospital na yun eh. So it's not new. In
yes
any
po.
case, yeah,
I think it's expansion of the services lang. So they can
yeah.
now cater mga angioplasty,
Mm.
in that facility, angiogram,
Mhm.
bypass, but hindi po siya balanse, no? So ang dami pa pong hindi talaga nakaka-access.
Okay, I think we will have to schedule you again, Congresswoman Tan, para mapag-usapan natin itong anomaly. So we can discuss this anomaly in our health system where poor patients need to go to congressmen, mayors, get letters of guarantee and allocation and to be treated in hospitals in Metro Manila. Gagaling ng probinsya, hihingi ng tulong sa congressman o sa politiko and then pupunta sa Manila. We hope you can give us that time in the coming future and thank you for your time this morning, Congresswoman.
Thank you, Sir Cito, for the opportunity. Anytime po, yes, we'll schedule. Looking forward po. It's a good discussion po yung issue na yan.
Okay, maraming
Okay.
salamat. And that is Congresswoman Angelina Helen Tan. She is the chairperson on the Committee on Health of the Congress. We'll go for a quick break and when we return, yung pong mga dumadaing sa akin ng mga mom and pop tourist, mga cottages, mga Airbnb, makinig po kayo because we're going to speak with Secretary Bernadette Romulo-Puyat here on Agenda. Welcome back to the program Agenda. I'm your host, Cito Beltran, and we are now going to bring in Secretary Bernadette Romulo-Puyat of the Department of Tourism so that we can get an update. Berna, good morning.
Yes, good morning, Cito, and good morning to everybody watching you right now.
How are you today? You still looking, you still continue to look lovely, but I'm concerned that you have a pullover, baka sinisipon ka or...
No, ano lang yan.
okay.
It's a Happy International Women's Day, and I just wanted to wear something Filipiniana. So Happy International Women's Day to all the women watching you right now.
Okay, alam mo naman, I'm always concerned about your
Oo,
health.
hindi, alam mo, Cito, tumataba lang ako, so I always wear something bigger.
Aba,
So-
kung tumataba kayo ng ayos niya, maraming magpapataba dahil gumaganda kayo. In any case, Secretary, good morning. And my primary agenda for today is
I know, I
bring-
heard it.
Yeah.
Oo, isa lang naman, you could have texted me pala.
Hindi,
So,
kasi
yeah.
parang nadinig naman nila na talagang
Correct.
in-address mo, no? Hindi
That's
kwento.
true.
So
Yes.
the question is, paano na raw po, what is going to happen to the people who have put up Airbnbs, mom and pop, cottage, resorts, etc. Kasi feeling daw nila that the focus is on the big hotels and resorts, and the local governments are getting tough on the small mom and pops.
That's probably best discussed with the LGU. Kasi what DOT accredits the ones with full service units under the law. So usually, but we've already been accrediting yung kunyari may full service na mga homestay, Airbnb. But what we in the Department of Tourism are doing, I know the last time we talked, that was our problem na kahit na MGCQ na, ayaw pa rin magbukas. Ayaw pa rin magbukas ng mga tourist destinations. But right now, at least, I just came from, I went to Puerto Princesa. They're finally opening March 15. They agreed to open. I went to Coron. Of course, they're already open since December, Coron and Baswanga. And then I came from El Nido. El Nido was actually open pilot tests July, and then everybody was open last October, and then bukas na rin ang San Vicente March 15. So in the mandate of the Department of Tourism is we accredit actually. That's really our we accredit, we make sure that all the establishments, those with full service, pass health and safety protocols. Now, those that are not under the DOT are under the LGU. It's really up to them to check yung health and safety protocols of the smaller ones kasi that's not under the DOT.
For the sake of those who are not familiar with the tourism parlance, what do you mean by full service?
Full service, for example, may certain given rooms, may mga yung may dapat may mga right now we asked for like may ongoing may nurse, not nurse actually, health na who can administer just in case may first aid, just in case may mga medical condition, somebody's there to check on the guests. Full service yung may breakfast, may restaurant, may yung kumpleto na everything you can find in a hotel. It's there. But the smaller ones are actually, as we know, these are under LGU license. I'm sure the ones that are complaining to you never got a DOT accreditation because they are under the LGU. So full service meaning everything that you can find in a hotel. Like yun na nga, yung yan.
Okay, so would you be inclined to give a push or at least kumbaga ilabi naman ng konti kasi medyo napubugbog na rin ako and mailabi sa DILG kasi marami po sila. There's so many of them and this is their bread and butter. This is where they make a living.
Cito, we're pushing talaga for the reopening. We've been pushing for the reopening hanggang nung nag-MGCQ na sila lahat.
Mhm.
kami. But we can only do so much, Sito, di ba? We could
Yeah.
only do so much. And we're just so happy. So ginagawa namin, for example, sa LGU, like we always ask them, bakit ayaw pa ninyo magbukas?
Mhm.
What do you think do you need? For example, some LGUs, they said na wala daw sila pang contact tracing. Wala raw sila online registration system. So kami na nagbigay nun.
Mhm.
Bale, ang the DOT kasi actually, our mandate talaga is accreditation and promotion. But right now, we are going above and beyond what we're doing
Ayun.
because of
That,
COVID. So,
no,
ang ginagawa namin, yeah.
yeah, that's very true, Secretary. Kanya nga kasi sa sobrang sipag mo and talagang inaasahan kayo ng DOT. I mean, I'm not flattering you because I know you personally, but you know, to this day, I still hear from our foreign friends who are complimenting the DOT on how they were saved, they were searched for, saved, and relocated by the DOT na nagka-lockdown. Marami pa rin nagpapasalamat sa amin.
I thank you.
And so we just, I'm putting that there. And ngayon, eto namang mga mom
Yes,
and pop,
yes.
kung
So,
pwede ka lang daw going Saint Bernadette, gagawin ka na nilang Saint Bernadette.
yun na nga parang what ano that's why I as early as last June, 'di ba, nung
Mm.
nobody was leaving their homes, I was already traveling all over the country. Kasi some of the LGUs, they really need to be my hand-holding, my assurance,
Mhm.
etc. So kami naman sa DOT, we talk to the LGU, tapos nagtatanong kami, what can we do to make you open up? Because masyadong marami nang nawalan ng trabaho.
Mhm.
And kasi nothing really beats restarting tourism.
Yeah.
Ang mga tourism stakeholders naman parang they would just really may pride tayo we want to work.
Yeah.
But in the meantime, like for example, since marami pang hindi nagbukas or kahit na nag-restart ang tourism, medyo matumal, we
Mhm.
were able to get financial assistance sa bayanihan too. All those working in, number one, syempre, employees of DOT accredited. Number two, employees of yung LGU license, nung hindi kasama sa DOT accredited. And then hiningi namin sa DOLE if we could expand it. For example, in a tourist destination like Coron, that they rely entirely on tourism, if we could give the workers there yung wala nang hanap buhay dahil walang turismo or mabagal ang pagbukas, so we are giving 5,000 financial assistance. Ultimo mga masus, yung mga tricycle drivers, na because of the expansion that we asked from the DOLE, nabigyan lahat ng 5,000 financial assistance. But I know this is very, very small, but you know, at least nakatulong man lang sa mga yung mga nawalan ng trabaho or nagkatrabaho man pero flexi time na. Kasi syempre hindi ma-afford. And then another thing is when we were nung nagka-lockdown, magwa 1 year na pala tayo, Sito. I can't believe magwa 1 year na tayo since the lockdown. Hinihingi ng mga small businesses, MSMEs, yung working capital loan. Kasi mahal masyado if they get from the banks. So
Yeah.
we were able to get from Bayanihan to 6 billion, and this was lodged under the SB Core sa DTI. So that's 4 years to pay, 1 year grace period, 0 interest rate, 0 collateral.
Wow.
Hiningi talaga namin yung grace period because kahit na mag-start, di ba, matumal mabagal. So you really, actually we wanted the 2 years grace period, but syempre, umangal na, hindi na daw. 1 year grace period, yes.
You seem to have a great idea behind pushing for tourism frontliners or tourism employees to be included in the vaccination of
Yes.
frontliners. Kasi ako ang feeling ko lang pag nagkatotoo, if you actually get the frontliners all vaccinated, then we will no longer have the disparity between hotels, resorts, and mom and
Yes.
pops.
Oo. Yes, ang una naming hiningi kay Sec Galvez, who is our vaccine czar, was sana kasi when I was looking sa IATF yung mga frontliners, syempre dapat lang naman una talaga yung healthcare workers talaga because they're in the hospitals every day. I mean, that's a given. And then sinama nila yung elderly because they're the most vulnerable. In fact, I'm not in the priority, but tama naman yung priority. But ang hiningi ko talaga was, can we include those first yung nasa quarantine hotels? If you recall, since March of last year, bukas na yung quarantine hotels. Everybody was home. But those working in the hotels, for the quarantine hotels, had to go to work. In fact, they didn't go to work. They had to live in the hotel because walang public. So we're grateful that sinama sila sa first priority. So all the employees working in quarantine hotels, kasama na yon. And it was not easy. A lot of them didn't want to go to work. But wala, saan sila pupulutin? And then after the first priority, I spoke to Sec Galvez kasama na, hiningi ko talaga, everybody working in tourism, not only for quarantine hotels, hanap buhay nila, they have to face people. And kasama na yon, it will be distributed in the different LGUs, and number one would be those working in tourism, because the very nature of tourism is we have to be with people, we have to talk to people. So kasama na. Tatapusin lang yung mga priorities, healthcare workers, elderly, and syempre yung mga frontliners, also those working in the airports, kasi sila yung mga tao day in and day out. And yun na nga, kasama na yung tourism.
Okay, now clearly your efforts have not been in vain, because there's now talk about MGCQ nationwide, although there is a pushback from some local government officials. In fact, naging issue nga yung Resolution 101 ba yun? Kasi may mga nagsabi pang turista lang yan. How do you differentiate tourists from workers? So sinabi ng DILG sa atin, ni Jonathan Malaya, na hindi, it applies for all. So where are we now, Secretary?
Well, ako naman, we pushed for the uniform travel requirements, or I must actually say it's the simplified travel requirements. We just finished our second travel survey, asking, the first was last May, and of course we had to make November with the AIM and the Guide to the Philippines, because we wanted to know the travel sentiments, why people are not traveling, or why are they hesitant not to travel. 81% said that naguguluhan daw sila sa travel requirements. Kasi ako mismo, Cito, actually I'm an APOR. Dapat pag APOR or government official, exempted kami. Dapat. But I choose not to be exempted, and we asked the DOT, all the DOT officials and all the employees not to be exempted. Why? Because we have to experience what the traveler is experiencing. Hindi namin may experience yung hirap if we're exempted. And ako mismo, Cito, okay naman ang test before travel, yung hinihingi ng LGU. I'm okay with that. But would you believe, negative na nga ako sa COVID test. Prior to this latest resolution, negative na ako sa COVID, I still have to get a medical certificate. I still have to get a PNP clearance. I still have to get a barangay clearance. And then meron pang affidavit of undertaking. I really do not know where I have to get that. So parang ang dami-daming nangyayari before I can go to a place. Di ba, the DOT is for ease of travel. Tapos hindi lang yon. Okay, tapos na yon. When you arrive, some LGUs pa require a 14-day quarantine. So, ubos na yung leave mo doon, di ba? So, with this uniform travel requirement, or I must say it's the simplified, wala na yung quarantine, except, of course, if may symptoms, COVID symptoms. I mean, that's already basic. But, and wala na yung health certificate, PNP, barangay, wala na yon, except, of course, if the LGU asks for it. So the most that you will the most that they will ask for is when you go, is if there's test before travel. It's either swab or saliva.
Mhm.
Yun. But
Ayoko
simplified already.
ayoko mag-violate sa stop mo. Sabi nila up to 850 ka lang, Sec. But just one important question because you mentioned about travel. What about inbound travel? Because I mean,
Mm,
like my daughter is supposed to come in for summer vacation. Sabi
yes.
ko, forget it. Because if you're going to spend 2 weeks under quarantine, etc., you might as well just stay there until we're all vaccinated.
Oo. Actually, sayang na sayang because before the UK variant, as soon as you're negative, you're good to go.
Mm.
But at the start, because of the UK variant, we actually already accepted balikbayans last December 7. Now, because of the UK variant, it was even suspended last January. But nung Feb 1, pwede na ang balikbayans. That's the third largest market of the Philippines.
Mhm.
And the quarantine was reduced from 14 to 6 to 7 days already.
Mhm.
Hindi na siya 14 days. But
Okay.
alam mo ba, Sito, in ASEAN, tayo na yung pinakakonti. In Hong Kong, it's 21 days inside
Wow.
the room. In
Mhm.
other ASEAN countries like Japan and Korea, it's 14 days. So, in Thailand, it's also 14 days. Singapore, it's also 14 days. Australia, it's 14 days. In Australia pa nga, you cannot choose what hotel you want to book. Bahala ang
Mm.
government. So, it's because of the UK variant and all the other variants. But I've been talking to IATF, we've been accepting case-to-case basis. Yung mga, for example, marami kasi gusto mag-film dito. So, we
Mhm.
have this big TV show that came here already. Nag 7-day quarantine sila dito in Manila, and then now they're in that tourist destination. But it's beautiful there. So another quarantine. So we're trying to do pilot na
Mhm.
paunti-unti. In fact, I'm encouraging the tour operators. Maybe we could bring it up to the IATF, yung mga fam tours, media tours, for them to see all the health and safety protocols. Now, it's hard to say because sayang, Sito, kasi we were already planning nga with Sec Anyo na we would be accepting all foreigners already
Mm.
by January, nagka-UK variant. So, yun. But, protocols are changing every single day. But,
Mhm.
yun na nga right when I'm about to say na, let's accept more foreigners, tumataas naman daw yung cases. So, this is what we do every day. But again, protocols are forever changing. Like, for
Mhm.
example, I came from Palawan and I looked at, kasi when we did the health and safety protocols in all the accommodation establishments, we did it under ECQ. So, dapat
Yeah.
that time, dapat daw yung dapat walang maglilinis ng kwarto. Kasi we wanted to minimize contact. Tapos naka-PPE lahat, and then dapat 2 in a room. But I was with the Department of Health, and then I discussed, MGCQ naman sila. And it does not make sense na when they enter the room, naka-PPE. Kasi ang PPE naman dapat if you're in contact with somebody with COVID or with symptoms. So we will be revising the protocols, making it less strict, making it more family-friendly. Like for example, kung isang pamilya naman, pwede na ng isang kwarto. We
Mm.
want to change that kasi para makatipid rin Kasi under the protocols now, limited yung number of people entering kahit na from one cohort.
That
So,
points out that you're really on the ball and on the money here because maraming nagsasabi rin, and I've observed this, Madam Secretary, no, na yung mga mayayaman, yes, they can afford the big hotels and
yes.
resorts, but they don't want to go out. It's the middle class, the lower middle class na ang tatapang lumabas, pero
Yes.
sabi, sana makami pupunta.
Correct. At saka gusto naman natin, syempre, makatipid. They can
Mm.
stay in one room, one family naman sila.
Mhm.
So, in fact, we're going to replenish. Ang mahal, di ba? Yung mga mayayaman naman, wala sa kanila yung RT-PCR test. I mean, that's really a drop in the bucket for them.
Correct.
But we subsidize. We have a tie-up with PGH. The RT-PCR is already at 900 pesos.
Talaga?
Yes. As long as you're a traveler and it comes out in one day. Kasi yun ang unang
Okay.
tinanong ko kay Dr. Gap. Baka naman 900 pesos, Kasi we're subsidizing 50%. Pero naman lalabas in 1 month, in 1 day. We have to replenish sa PCMC, Philippine Children's Medical Center, because we also had the same tie-up with them. 750 pesos lang yung RT-PCR.
Actually, yung secret ko kasi I am one of the supporters of Philippine Children's Medical
Yes.
Center. Secret namin yun. Namura doon kanya lang wala ring supply.
We naubos lang last Saturday kasi we give funds kasi they charge 1.5 and then binagsak namin, we subsidize 50%, naging 750 pesos na lamang. But we will soon replenish it because we want sana travel for those that cannot afford. In fact, when we did sa subsidy, sinabi naman namin, we cannot give subsidy kung titira ka naman sa 5-star hotel. Hindi mo na kailangan ng subsidy.
Correct.
That is really for those yung lower, 3-star and below.
Kumbaga,
Pero,
kung kaya mo, kung may cake ka, ibalato mo na doon sa mga ordinary people.
Diba, Cito, may kaswapangan. In fact, nakatatawa ko when I first announced that, yung mga natitira sa 5-star hotel, sila yung unang nangungulit about the discount. Tapos we had to gently tell them, no, this is for those that cannot afford.
Yeah.
Kasi sayang naman yung subsidy na yun, mauubos sa kanila. And the mere fact they can afford a 30,000 a day room, they can afford the RT-PCR swab.
Okay. Bigay na doon sa, medyo limited ang budget. Okay.
Yes.
Madam Secretary, baka mapagalitan ako, tsaka baka mapagalitan yung EP ko. Napasarap lang yung kwentuhan.
No,
Thank
Cito, you
very
have to invite me because you're not inviting me.
Ayan na. Ayan na. Sinabi na sa inyo, team agenda. Ako pa ngayon na napagalitan. Ako nagpahanap. Okay. Well, I
Yes.
will invite you yet again, Madam Secretary.
Maybe every 2 weeks I can discuss because ang bilis nang nangyayari with tourism.
Okay. I will
So
do that.
we can continually update.
Yes, ma'am.
Bye-bye.
Thank you very much.
Bye-bye.
And, okay, bye-bye. That's Secretary Bernadette Romulo-Puyat. Ayun po ang maraming magandang kwento. Bakit kanyo? Good news because now there is affordable RT-PCR. Tawagan nyo lang yung DOT. Ask the DOT, where can we get this affordable RT-PCR na 900 or 750 only? Yung sa Philippine Children's Medical Center, medyo limited po yun. And as Secretary Bernadette Romulo-Puyat pointed out, they have to replenish the fund. So don't rush there right now because chances are you're not going to get that special deal, okay, for those of you traveling. Now, we are asking, imploring all our friends, please, kung may kaya naman kayo, ibalato nyo na dun sa mga limited budget na mga Filipino, yung ganyang RT-PCR charges na 900, 750. Kasi para sila makabiyahe. And actually, ironically, what I know, many of the rich people, the can-do people, they actually don't travel. They're so afraid and they've become more, accustomed to their way of life at home. So, yung pong mga limitado ang kakayanan, bigyan na natin sa kanila yan. Let them travel and I do hope that the mom and pop operators, the Airbnbs, I'm appealing to the mayors, governors who by chance might be watching us, please, please, please find a way to open up these facilities with a community arrangement for doctors, nurses, health protocol, guidelines, but help them to open up because this is not about just tourism. This is about livelihood. Dito po ay pagkain ng tao. Okay? So, let's help each other. And with that, we bring our program to a close. Thank you to Congresswoman Helen Tan and thank you to Secretary Bernadette Romulo-Puyat. Yun po yung mga masarap ma-interview, yung willing magpa-interview at nakakapagbigay ng kaalaman. Thank you for joining us. May the good Lord bless you. May He give you a beautiful week. And I thank God for this beautiful day. And I hope you are all happy. That's Agenda for You.